Each year, we set membership fees to support the financial sustainability of CMPA while striving to keep fees as low as possible. Membership fees in each of our 4 fee regions reflect regional variations in medical legal costs, the number of physicians in the region, and the risk levels of their different specialties. Medical legal costs are calculated each year and include the estimated costs to compensate patients and support our members for up to 4 decades. We are committed to stewarding our members' fees responsibly. Our goal is to achieve long-term membership fee stability in an environment influenced by volatility in both the investment markets and medical legal costs. To manage our financial position and help dampen large variations in fee volatility, we apply fee debits and credits. Since 2019, we have provided members with increasingly greater fee credits, reaching their peak in 2023. Over the past 3 years alone, we have given $670 million in fee credits. Due to poor market performance in 2022, we had to increase our fees in 2024 to better prepare for future medical legal costs. In 2023, the markets performed better than expected, and our financial position stabilized, which is a positive story for 2025 fees. Overall, the 2025 average membership fees, which I am about to show you, are similar to those in 2021. As mentioned, the CMPA has 4 unique fee regions in response to the regional cost variation across the country, allowing for an equitable allocation of costs. The 4 regions are British Columbia and Alberta, Ontario, Québec, and Saskatchewan, Manitoba, Atlantic provinces, and the territories. Each region is independent, and there is no subsidization between regions. For example, if one region is in a positive or negative financial position, this does not impact the other regions. The total cost per region is the amount to be collected in each region. The average fee per member is an illustrative number that is the total cost per region divided by the number of members in that region. It is an average and not an actual membership fee. When determining membership fees, we first calculate the total cost for the region and use this as the foundation to determine regional fees based on specialty, which we call type of work. I will now share the 2025 average fee requirements, starting with British Columbia and Alberta. The average fee requirement in British Columbia and Alberta remains unchanged from 2024. It is worth noting that the 2025 average fee is less than pre-pandemic levels. The total regional fee requirement increased by $6 million to $154 million. However, this is a level we consider viable, and there was no need to increase the average fee requirement per member. In Ontario, the cost of providing medical liability protection is greater than in any other region, and this is reflected in the membership fee. As with British Columbia and Alberta, the average fee requirement per member in Ontario is not changing in 2025. While the total regional fee requirement in Ontario increased by $11 million to $336 million, we also consider this a viable change, with no need to increase the average fee requirement per member. After several years of unprecedentedly low membership fees in Quebec, the average fee per member will increase to be more in line with the anticipated medico-legal costs. For 2025, The total regional fee requirement in Quebec will double from $5 million to $10 million in 2025. Although this is a 100% increase from 2024, you can see that the average fee requirement per member is still much lower than it has been in previous years. Like Quebec, membership fees in Saskatchewan, Manitoba, the Atlantic provinces, and the territories were unprecedentedly low in recent years. And like Quebec, the average fee requirement per member will increase to be more in line with the anticipated medical legal costs. In 2025, the total regional fee requirement will more than double from $10 million to $21 million. As you can see, the average fee requirement per member will similarly increase. However, it is still much lower than it has been in previous years. Here is an overview of recent average membership fees by region. As you can see, even though the 2025 fees have increased in Quebec and the Saskatchewan, Manitoba, the Atlantic provinces, and the territories fee regions, fees across all regions are still below pre-pandemic levels. Having shared the average fees per member, here is an example of the actual membership fees for family physicians practicing in Type of Work Code 35, which is our largest type of work code. The full listing of 2025 membership fees is now available on our website. You will be notified by email in the fall when the annual invoices are available on our website via the secure CMPA member portal. Our strong financial position should assure members that we will continue to be there for you and compensate patients proven to have been harmed by negligent care on your behalf today, tomorrow, and well into the future. Thank you.